Dr. Silber, perhaps one of the most asked questions is, what is the difference between IVF and mini IVF?
Well, that's a good question. And I'll try to be simple about it. Now, there are two hormones that we use to stimulate, FSH and LH. FSH only is going to recruit follicles. That's all it does. Really doesn't have anything to do with egg quality. It's just recruiting follicles. LH, in a very, very small amount, is necessary for egg quality, even in the beginning part of the stimulation. So you don't want to use too much FSH. And what we found is with low dose FSH, we're getting just as many eggs as if we pounded the patient with huge doses that made her miserable. And the baby rate per egg is actually four to five times higher at any given age than with maximum we call COH paper that we published. But normally the baby rate per egg, Pasquale Patrizio, Dr. Patrizio in Florida was the first one to actually publish this, is about 6% per egg. But really, with minimal stimulation, at least if the patient is under 35, it's about 25% per egg. So it's just a dramatic difference because we're not ruining the egg with an overdose of FSH gonadotropin. And also, we're making sure there's LH, which is responsible for egg quality. Now, many clinics, and we used to give microdose HCG for egg quality, but studies from Germany showed very clearly that LH is better than HCG for early embryo quality. That's just part of it. Another part of it, which is sort of obvious, is we always have to pre-treat with birth control pills. Anything that will kill off the developing follicles that would be overcooked if we started stimulating them just to get follicles so we can get the egg out of the ovary, because all those eggs are always being exposed to FSH and LH. So if we don't kill off those eggs that are already partly developing, then when we stimulate, we get a lot of bad quality eggs. So there are a number of principles involved in mini IVF, and it's just all related to the endocrinology of how the ovary really works, not just pounding the patient with huge doses and neglecting just the simplicity of it all.